Chair now recognizes the gentlelady from Texas, Representative Fletcher, for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, do you know the requirements for hospitals under the Emergency Medical Treatment and Labor Act, which is commonly called by its shortened name, EMTALA?
Yes, I do.
And just generally, what do you know EMTALA to require of hospitals?
That every hospital has to treat anybody who comes to the emergency room.
And they have to provide stabilizing care regardless of their ability to pay and regardless of the type of care required, correct?
Exactly.
And Secretary Kennedy, you understand that American College of Obstetricians and Gynecologists, the American Medical Association, and the Society for Maternal Fetal Medicine, in certain circumstances, necessary stabilizing care for the purposes of fulfilling a hospital's obligation under EMTALA could be providing abortion care, correct?
Welcome back to America First, the channel where we put American values and common sense first in every discussion. If you're new here, make sure to hit that like button and subscribe, because we're going to break down the real issues affecting our nation without the mainstream media filter. Today, we're reacting to this congressional hearing featuring Secretary Kennedy and Representative Fletcher discussing EMTALA and emergency medical care.
In cases, for example, ectopic pregnancies and botched abortions and in miscarriages, those hospitals are required to provide care. Elective abortions, they're not.
But they are required to provide abortion care if that is the care that a physician treating the patient determines in their medical judgment is the care necessary to stabilize the patient and to protect their life and health, correct?
And because there were confusion about that, I sent out a letter to every hospital in America restating that in those conditions they must provide care.
Okay, and I think that that's consistent with what we have heard from emergency physicians, obstetricians, other treating physicians that have made clear that in certain circumstances, clinically recognized, evidence-based, necessary medical treatment in various circumstances, including but not limited to the ones you just listed, abortion care is the necessary stabilizing care, or some kind of care that may end a pregnancy. So in those cases, you would agree with me that EMTALA requires the hospitals to provide that care?
Yes.
And
that's what President Trump believes.
And you just mentioned that you issued some guidance to all the hospitals and care providers across the country, rescinding some guidance from the prior administration and making clear that that is the requirement. Now, the guidance that you rescinded was issued shortly after the Dobbs decision, which was announced 3 years ago today, and created some confusion. And so I think one thing that's important, one thing that I hear from doctors in states like mine, is that this kind of guidance and clarity is very, very important to giving the practicing physicians the comfort that they need to do their jobs. And so I think it's really important that you continue, and I hope that you'll continue to make as clear as you have today in this hearing, that EMTALA ensures and protects pregnant women in all 50 states.
I will continue to do that, Congresswoman.
And with the time I have left, on one other note, in response to some questions from Mr. Pallone earlier, he talked about, as I believe Ranking Member DeGette has as well, several of the letters that our committee has sent, or members of our committee have sent to you with concerns about actions being taken at HHS. And certainly, I agree with a lot of those concerns. I represent Houston, Texas, and we have an incredible amount of research going on through National Institutes of Health, incredible development of all kinds of transformative therapies and treatments. And so we have a lot of concerns. I know you mentioned that you have gotten thousands of letters from members of Congress, and I can appreciate that. But I would ask that, recognizing that this committee, the House Energy and Commerce Committee, has jurisdiction and is the committee of jurisdiction over HHS, that the requests that come from the ranking member that come from the Energy and Commerce Committee get prioritized by your staff in terms of looking at congressional responses. I think it would be very important because we have jurisdiction, and you've indicated you'll work with a lot of folks here on a lot of different issues, and getting those answers and being able to work to address the concerns that we have is really important. So I just ask that you prioritize those responses.
You have my commitment to do that, Congresswoman. And I would also say this, and it's the same thing that I said to Congresswoman Dingell. It's not our intention to cut anything that is the kind of research that you're talking about, which is critical research. We need to keep America the hub of that kind of research. And there was some malicious compliance. There was some mistakes made.
Thank you, Mr.
gentlelady's
Secretary. My
time
time
is-
has expired, and so I will
time
go
is-
back.
Examples, contact us, and we will redress them.
The chair now recognizes the
Let me start by saying what I appreciate about this exchange. Secretary Kennedy is being direct and honest about the law as it currently stands. The Emergency Medical Treatment and Labor Act, or EMTALA, has been on the books since 1986, and it's fundamentally about ensuring that people in genuine medical emergencies get the care they need regardless of their ability to pay. That's actually a principle most Americans can get behind. What's encouraging here is hearing Secretary Kennedy confirm that the Trump administration's position aligns with existing federal law. When someone shows up in an emergency room in a life-threatening situation, hospitals have an obligation to provide stabilizing care. This isn't about elective procedures or abortion on demand, which is what many of us have been concerned about. This is about genuine medical emergencies where a mother's life is in immediate danger. Representative Fletcher brings up specific scenarios like ectopic pregnancies and incomplete miscarriages. These are real medical emergencies where swift action is required to save a woman's life. An ectopic pregnancy, for instance, occurs when a fertilized egg implants outside the uterus and can cause fatal internal bleeding if not treated. This isn't a political issue. It's basic emergency medicine. What I find particularly important is Secretary Kennedy's clarification that we're talking about situations where a physician, using their medical judgment, determines that specific care is necessary to stabilize the patient and protect their life and health. This puts the decision-making authority where it belongs, with trained medical professionals, not politicians or bureaucrats. The Secretary also mentioned sending guidance to hospitals across America to clarify these requirements. This kind of clear communication is exactly what we need. Healthcare providers shouldn't have to guess about their legal obligations when someone's life is on the line. They need clear, straightforward guidance so they can focus on practicing medicine. Now, I want to address something that's been lost in a lot of the political rhetoric around this issue. Supporting emergency medical care that saves women's lives is not inconsistent with being pro-life. In fact, it's entirely consistent with valuing life. When we're talking about ectopic pregnancies or severe complications during miscarriages, we're often dealing with situations where the pregnancy is already non-viable and the mother's life is in immediate danger. What troubles me about the broader debate is how these genuine medical emergencies get conflated with elective abortion procedures. Secretary Kennedy was very clear that elective abortions are not required under EMTALA, and that's an important distinction. We can support emergency medical care for women in crisis, while still maintaining our principles about the sanctity of life. Representative Fletcher also brought up confusion that followed the Dobbs decision. I think it's fair to say that there was confusion in some quarters about what various state laws meant for emergency medical care. That's why clear federal guidance on EMTALA obligations is actually helpful. It removes ambiguity and ensures that women in genuine medical emergencies get the care they need. The Congresswoman made a good point about giving physicians the comfort and clarity they need to do their jobs. Doctors shouldn't have to second-guess whether they can provide life-saving care in an emergency situation. When someone's life is hanging in the balance, medical professionals need to be able to act swiftly and decisively. I also want to commend Secretary Kennedy for his commitment to continuing this kind of clear communication. Good governance requires ongoing dialogue and clarification, especially on complex issues that intersect law, medicine, and deeply held beliefs. The end of this exchange touched on congressional oversight and the importance of the House Energy and Commerce Committee's role in overseeing HHS. This is actually a perfect example of how our system of checks and balances is supposed to work. Congress has a constitutional duty to oversee executive agencies, and it's good to see that relationship being taken seriously. Representative Fletcher also expressed concerns about maintaining America's position as a leader in medical research, and Secretary Kennedy's response was reassuring. We absolutely need to maintain our edge in medical innovation and research. That's not just good for Americans. It's good for people around the world who benefit from American medical advances. Here's what I think this exchange ultimately demonstrates. When we strip away the political posturing and focus on the actual substance, there's often more common ground than the media would have us believe. Most Americans support emergency medical care for women whose lives are in danger. Most Americans support clear legal guidance for healthcare providers. And most Americans want our country to remain a leader in medical research and innovation. The key is making sure we're having honest conversations about what the law actually says and what it actually requires, rather than getting caught up in hypothetical scenarios or political talking points. Secretary Kennedy and Representative Fletcher had that kind of substantive discussion here, and that's what we need more of. What this hearing also shows is the importance of having people in positions of authority who understand both the legal requirements and the practical realities of emergency medical care. Secretary Kennedy demonstrated knowledge of the relevant law and a commitment to ensuring that guidance is clear and consistent with both legal requirements and medical best practices. As we move forward, I hope we can continue to have these kinds of fact-based discussions about healthcare policy. The American people deserve leaders who can navigate complex issues with both principle and pragmatism. They deserve clarity about what the law requires and assurance that women facing genuine medical emergencies will receive the care they need. That's going to wrap up today's analysis. What did you think of this congressional exchange? Do you think Secretary Kennedy provided the right kind of clarity on these issues? Let me know in the comments below. And remember, if you found this breakdown helpful, hit that like button and subscribe to America First for more honest analysis of the issues that matter most to our country. Until next time, keep putting America first.